So in this video, we're going to discuss some of the challenges that hyperopic patients face when they also have convergence insufficiency and they want to try and wear their glasses, but it can feel like it makes the convergence insufficiency more challenging to overcome. What those patients face and feel is dead on, meaning when you're a hyperope, your eye is not the correct shape to the point where you actually need more plus power in order to see clear. The challenge with hyperopic patients, especially when they're young, is I like to call them little cheaters, mostly because I'm jealous because I was myopic. But these patients can essentially self-correct part of, if not all, of the prescription that they need in glasses. Meaning, if they are looking out at a tree, they can flex their ciliary body muscles. They can make this lens thicker, like a magnifying lens, and they can then bring those light rays into focus. When we make this lens thicker, it becomes more plus in power. So they have essentially corrected for the misshape of their eye. The challenge with this is that when we flex these ciliary body muscles, these muscles are designed to only be used when we are reading. So our brain gets confused about space when we flex these muscles to see a tree a long ways away, and we should be diverging our eyes. For hyperopic patients, when they're looking up close and we flex these muscles, they have to flex these muscles too much because maybe they're not wearing their glasses or they haven't been given glasses yet. They will then converge their eyes excessively. That can certainly be a problem. And it can actually be a problem that leads to a lazy eye inward or an inward strabismus or eye turn. But if the patient is hyperopic and they also have convergence insufficiency, so they're making a miscalculation in space to where they autonomically aim their eyes and miscalculate and aim their eyes too far out, then that extra work of flexing these muscles because their eye isn't the correct shape can almost act as a crutch or a bit of an aid. Now, of course, it's not the perfect scenario because now when they're reading a book, instead of flexing these muscles to make this lens a +2, now they have to flex it to make them a +3 or a +4 because they're not wearing their glasses. But so now they have to do that. But at that same time, that extra work is going to kind of correct or aid them in their convergence insufficiency. So we really have this battle. If I wear the glasses, it alleviates these muscles from having to do extra work. But if I wear the glasses, it takes away that signaling that's helping me with the convergence insufficiency. So as I tell my patients, I recommend, and my goal is that I can help you so that you can put on the glasses and everything is easy peasy. You put on the glasses, your brain makes the correct calculations about where the world is, and you automatically direct and converge your eyes to the right point in space. But as we go through therapy, the glasses are not going to fix the convergence insufficiency. There is no glasses prescription that can fix convergence insufficiency. Glasses are like a shoe. They can go on the foot, they can help you sense the world better, they can make corrections if your foot isn't shaped just right, but they cannot teach you how to walk and control the muscle movements. They can make it easier to learn how to walk, but they're not going to help with those muscle movements. And that's what convergence insufficiency is. It's a problem with guiding, neurologically guiding and sending appropriate instructions to the muscles. So this is, again, like I said, this video is really kind of hopefully breaking down in an understandable way how hyperopic patients, so patients who need a plus prescription, have a little bit of a tougher time adjusting to, getting used to, and being able to wear those glasses when they also have convergence insufficiency. They will feel like the glasses make the convergence insufficiency harder to overcome, and that is a correct and appropriate feeling. The glasses will make life easier for these muscles, but harder to overcome the convergence insufficiency. Luckily, that's where vision therapy comes in. So the goal is that eventually you can wear the glasses to alleviate and remove the excessive strain put on these muscles that shouldn't be there. And then the vision therapy can get rid of the convergence insufficiency. But in the meantime, it's tough. I normally tell my patients, you can wear the glasses, again, depending on the prescription, the situation. But I have told even up to like 7-year-olds, you can wear the glasses as much or as little as you want. If you put those glasses on for reading and it feels good for a little while because you're alleviating these muscles, but then after a while it gets tough because it can't fix that convergence insufficiency, then take the glasses off. It's my job to make sure that you can eventually wear them full time or do contacts, do LASIK someday, you're good to go. So hopefully this video kind of made sense of that and kind of explained why I will say to my patients that they can wear the glasses kind of as much or as little as they want to with the goal of wearing them more.